Hello, this FERNE presentation discusses the emergency department care of patients with dizziness and vertigo with an attempt to diagnose and treat serious central etiologies. My name is Edward Sloan. I'm an emergency physician. I have no financial conflicts and I've served as FERNE president and board chair for over 3 decades. Please go to our FERNE.org website and our YouTube channel for more content related to the optimal care of patients with dizziness and vertigo, and go to our social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies, FERNE.org. So, in our last presentation, we talked about the dictionary definitions of dizziness and vertigo. I now take us to a 2016 publication by Drs. Edlow and Newman-Tokar that describes and provides more precise dizziness and vertigo definitions that have been provided to us by a consensus group. Dizziness, how is it defined by the group? Dizziness, sensation of disturbed or impaired spatial orientation without a false or distorted sense of motion. In other words, when you feel giddy, lightheaded, or dizzy but have no motion, that would be dizziness. How is vertigo defined? Vertigo is the sensation of self-motion, either of the head or body when no motion is occurring, or it's a distorted sense of motion during an otherwise normal movement of the head. In other words, vertigo includes motion. Vertigo can include a rotational component, a linear component, or some static tilt relative to gravity. In other words, if you feel like you're spinning, rocking, falling downward, those are all vertiginous feelings. What is pre-syncope, near syncope, or faintness? Pre-syncope is faintness or an impending loss of consciousness, which may or may not be followed by syncope. What is syncope? Syncope or fainting is the transient loss of consciousness that involves global cerebral hyperperfusion. It has a rapid onset, short duration, and a spontaneous complete recovery. It is often associated with loss of postural control and falling. What is unsteadiness? It formerly was known as disequilibrium, but unsteadiness is the feeling of being unstable while seated, standing, or walking without any particular directional preference. What is directional pulsion? How is it defined? It is the feeling of being unstable where you feel as though you're going to veer or fall in a particular direction while seated, standing, or walking. So it's unsteadiness in a direction. This is a picture from skiing at the top of Snowbird in 2019 during a whiteout. When I skied and I stopped, my eyes continued to move and my body appeared to move in an unusual way consistent with directional pulsion. So you can see these precise definitions are superior to those found in the dictionary, and they will allow us to understand better how we define dizziness and vertigo in our patients in the emergency department. If you have comments or questions, please get a hold of us at fern.org@gmail.com. Thank you very much and have a good day.